Welcome friends to the second part of Doc and Doc Infertility Decoded. In our first video, we discussed some myths about infertility. In this part 2, we'll be busting some more myths about infertility. So we have Dr. Sandeep Karunakaran again with us.
Hello ma'am.
Hello sir. So sir, there is a very popular belief that once a couple has a kid, the couple cannot be infertile. Is it true?
Well, it is not true. Primarily because the first kid they had was at a younger age. So the deterioration of their gametes will happen with time. Plus there's always a chance of infection. Some tubal obstruction can happen. Some incident like disease conditions which actually affect fertility, and so on and so forth. Obviously the stressors keep increasing with time. Also the exposure to environmental pollutants also has to be factored in, and hence it is not true that once a parent, always a parent. The second child might be actually more difficult than the first one.
Thank you, sir. There is one more belief, like from your statement, you said stress causes infertility. Is it a primary cause of infertility?
Well, stress is like the environment in which a plant grows. You know, if a plant is put in a stressed environment, it will never grow. So, if you consider for infertility as divided into the seed, that the baby, the soil, that is the uterus and the body, and the environment in which the baby has to implant, stress plays a very important role. It affects at all the levels, be it production of gametes, be it fertilization, be it implantation, or be it carrying on with the pregnancy per se.
Thank you. Do you think there are some food or food habits which contribute to infertility?
If you're talking specifically to food, there are certain diet which actually improves the fertility potential. One of them, of course, is to avoid high glycemic index food, something which is very, very sweet, something which is oily. All these things do affect. Highly processed food like maida, etc., chocolates for that matter, also reduce your fertility potential. What is helpful is dark green leafy vegetables, also nuts which contain certain oils which improve the fertility potential. In other words, avoid toxic things and try to live a life with a diet which is as healthy as possible, as close to nature as possible.
So, in general, what we call is healthy diet is helpful in treating fertility.
Absolutely.
Okay. So, that's all from this video. In our next video, we'll be busting some more myths. Thank you.